Okay, good afternoon, everybody. They always say that the session after lunch tends to be one of the most challenging. For one, we don't derive the satisfaction and the pleasure of having a large audience sitting in it. But I say, إنكم أنتم بتكفوا بتوفوا زيادة. Thank you all for making the time and the effort to attend this session. Our session today is about healthcare, IT, and innovation. So my name is Rami Adwan. I'm the moderator. I'm going to be introducing the panel, and I'll just start this session by opening with a couple of remarks. So basically, the healthcare sector faces a lot of challenges these days. People are getting older. As they age, they are gaining, well, they're becoming a lot sicker, and the populations are increasing. And at the same time, there is a lot of innovation and technology advances taking place. We all know about the major headlines. We're talking about cloud, security, mobility, big data, wearables, etc. Equally as much, patients are becoming a lot more demanding. Patients are not satisfied with whatever they used to do and get in the past. They want to know, they want to have higher efficiency, improved administration, they want to have access to data, and all sorts of what you call it. The economies of the world are not growing as fast, so while in the past we may have had the luxury of spending a lot, we are not able to spend as much as we used to do in the past. Against this backdrop, we're obviously speaking about challenges that are facing the healthcare sector, the provision of service in the healthcare sector, as well as opportunities that could be posed by IT, information technology and innovation for the healthcare sector. So on this backdrop, allow me to introduce our speakers. To my left immediately is Mr. Feras Kamal, the CEO of Electronic Health Solutions, which is a Jordanian private company, not-for-profit, that is mandated with the automation of public sector healthcare facilities through introduction of electronic health records. Next to him is Mr. Imad Deir, the GM for healthcare practice within Optimiza. Optimiza has a well-established practice in healthcare. They have developed their eHope platform, which automates both front and back-end operations of hospitals and clinics. Next, Mr. Jalil Labaddi, who is the CEO and founder of Tibbi.com. Tibbi is a Jordanian-born company, the largest information and medical information portal, as well as interactive and frontline of consultations, medical consultations available for people. Next to him is Mr. Ahmad Tijani, the CEO of NatHealth. NatHealth basically is a third-party administrator, which is an insurance claims processor. They have developed great innovations in the way of automating the process of insurance claims, and through this work, they have been able to use a lot of the data for major innovations. He'll be able to tell us about it. Let me not get carried and take your bit from that. And then we have Muhammad Jamal, our friend, who heads the tech app and innovation with IMS. IMS basically is an international player who is a service operator for healthcare facilities and pharmaceutical companies, and they have a major arm dealing with big data and analytics. Well, before I start, actually, I just want to take a quick survey of the audience. So if you could all, let's take a minute, bear with me, look at the panel, and let me see with a show of hands, how many people here are actually have direct involvement with the healthcare sector? Just with a show of hands. So we have about 3 or 4. Okay, how many people have done IT for the healthcare sector? Okay, 3 or 4. How many are investors that are possibly considering investment in that field? Okay, and the rest, I assume, are just general curious people about IT. So thank you all for making the time. I hope then we will not get too technical on medical terms, nor about specific technology matters. Let's try to make it as meaningful to our dear audience as possible. So I'm going to open up the discussion with you, Jalil, basically imagining a utopic world, okay, where the patients have access to data, they have access to medical information, frontline, they are able to use feeds from their wearable devices, you know, all sorts of small gadgets and so on. And this is automatically or possibly connected to more formal data reservoirs like the healthcare records, the electronic health records for the government in Jordan, and that is automatically connected with the payers, and where big analytics, where big data analysts can come and look at that. Where are we from this? And I mean, you've created a Tibbi. How does a Tibbi live within this utopic vision of such a connected healthcare sector, if you would?
Thank you, Rami. That would be a perfect world, wouldn't be? We are very, very far from that. Yes, we have been building, not us, but around the world, we've been building bits and pieces around all what you've been saying, and wearables, and technology, and connectivity. Yet we are far from integrating all these pieces together, but we are on the right path, I think. On Al-Tibbi, we have been providing content, we're providing access to doctors in real time so that patients can be empowered and learn more before going to the doctor, which is part of that connectivity. So when imagine if they have a wearable, they go to the doctor can immediately know the history of that patient. The patient is already knowledgeable of the case he's going for. That will save time, that will save money, and would increase the efficiency of healthcare in general. So yes, we are all talking about bits and pieces, but I think we are far, especially in this region. We are very far behind, maybe a bit more ahead in Jordan, but overall we are far behind.
Are you in Al-Tibbi putting, plugging points for this kind of direction?
Absolutely. As I mentioned, on Al-Tibbi, yes, we provide a lot of content. So a patient can read about whatever is concerning this patient before considering a visit to the doctor. They can talk to the doctor in real time, and then all of this visit or page views plus the conversations are all stored on a history so that it can be shared later on with the doctor to have a comprehensive health history, but from the user side, not on the medical back end side. So yes, we are building that little small piece of it, but of course, in a big universe, we're still nothing.
Fair enough. Faisal, are the questions available if I would ask for one to go up now? Okay. We'll just take a moment to check because we have a question for the audience I would like really to tap into. That's fine. Okay. So connecting from where Jalil has spoken, obviously this is a platform, a collaborative platform where patients are able to get information in Al-Tibbi and consult with doctors online, and as well as provide through wearables and gadgets a lot of data automatically to their records and their reservoirs. You deal with a more formal and a more rigid, well, formal is the word really, reservoir of data for us. You're automating the health records for the country, and that's basically only accessible to doctors to enter the data, not the patients. Do you see that as an imaginary, empowerment target, or do you see it happening? And okay, how do you connect it with what you are doing?
Basically, I would like just only to state for a fact, as of today, we have about 1.5 million patient records within our database, and it's a single database. The beauty about it, definitely, I mean, we really to be able to integrate with other providers, I mean, pharmaceutical companies, even something like Tibbi at a stage where we would like to explore and envision the idea of Internet of Things, because this is where it gets more important to connect all those together for a big data analysis, and then start to pulling more data based on that. Basically, as of today, I mean, we put the first cornerstones, or if I may say, the milestone, which is the EHR, the electronic health records. This, I mean, again, this platform would allow for a future other steps to be taken forward, like patient empowerment by means of having a personal health record, to be able to communicate and to the main patient record of the patients. Again, this sort of things, it's happening right now in the US. We're not trying to be far advanced than them. We're learning as others, they're doing it, and that's the beauty about it. So it saves us the investments, it saves us to know the direction of the of the people, what they need, and how you will be able to do it. Because as of today, if you talk about personal health record, which is the PHR, versus others, they call it portal, for the patients, there are lots of things that you need to be taken care in terms of legality, in terms of medical legals, and how this will be tapped together. It's the future, and I agree that definitely at a stage, all this data needs to be pulled together in order to be able to do more analytics based on that and pull the data that's needed for us in the future.
Thank you, Feras. Well, before I get into the analytics bit, I just want to get to Imad. Imad, obviously you've got your platform, eHope, and this is intended to automate hospitals. How has your experience been? I mean, is it working in the region? I mean, you know, private hospitals, they care about the money side. The public sector hospitals and the public sector healthcare operators or providers care about the data and the medical side. So what is your take on where we are going with this and the state of technology in the region?
Actually, we're having a big challenge with both the private and public sectors. So talking about the private sector, there's a big challenge when it comes to the financial part. So allocating budgets for IT solutions while they can go and buy medical equipment where they think that the return on investment is much higher, now they would definitely go for other options. So creating the awareness at the private sector and make them realize that, you know, investing with such HIS solution would definitely improve the quality of the service and have more controlled medical records with all the safety and security measures. This is a big challenge. Now with the public sector, it's even worse because, you know, with the especially now in the region with the oil prices dropping down, so all the provisions for the healthcare sector are going down and down. So this becomes a big challenge, you know, having a national unified medical records on the nation level, on the country level. This becomes a big challenge for all governments.
Do you feel which countries in the region have taken the step to having this unified set of data?
I think Emirates is in the lead.
As an entire Emirates or as the state of Dubai versus the state of Abu Dhabi? And
through HAD, actually, Health Authority of Abu Dhabi. Basically, they are the regulator in the Emirates, so they have already designed the health system in UAE, and they monitor the performance and the implementation of this system and make sure that everybody complies with it.
Fair enough. So we've
just one thing.
Go ahead.
They've also setting the standards in the healthcare industry. So when it comes to the compliances, the international standards and the standards.
We're going to get to the standards in a minute because that's probably one of the challenges that we are facing in this region, and, you know, more on setting them as opposed to complying to them in the West. Yeah. But before we get to that, I'm going to get to Mr. Mohammed. Mr. Mohammed, obviously we've got the personal health record portal with the consultations that's generating a lot of data on patterns and on personal data. We've got the more formal data. We've got a view on the region. So a lot of effort happening there, and a lot of data is being generated. This is just taking a large form, and, you know, sometimes they say the biggest problem with big data is what to do with it, really. So IMS has done some work in that respect, and I understand from your colleague Tariq Al-Tayyib, we were chatting a couple of days back, that you are doing some work in the Emirates on that. So the Emirates and your vision as to where this is going. How are we going to use this big data? Are we ready to use it, or just setting the infrastructure?
Okay, first of all, we already done project in UAE with the government, Dubai Healthcare Authority, connecting all MOH hospitals through e-claim link. So it's connecting providers to payers, also the patient to the government. They using the portal link to process the e-claims. All this data processing through IMS Health. We store the data in our data center, which is encrypted. The data of a patient is not viewable except for authorized persons. It's a lot of records. We are already have experience in this. We're also going to implement the same in Saudi. We are working on the project also with the CCHI, Council Cooperative of Healthcare, Health Insurance in Saudi. The same concept that providing the software, the application, and also the IT infrastructure, organizing with MOH authorities to globalize, to centralize this e-claim procedure all over the web through application and portals.
But what sort of work have you done with the data? You said you're already doing it. Yeah. So, I mean, you've got a lot of data. Can you give me examples of uses of this data in the medical field?
You know, we give insights, analytics for the healthcare, for the authorities, and somehow for the pharma companies if needed. You know, but the patient, again, patient personal data is coded. You just give insight and analytics in how many patient, how many claims, products detailed.
Okay, fair enough. Thank you. Ahmad, I mean, you know, they say money makes the world go round, and you're obviously on the money side on this panel more than anyone else. You're the insurance, you're the third-party processor, the one who should say no, and no, you can't have it, no, you can't spend it, you can't do any of it. So, I mean, you know, you started doing that, and then you ended up putting a large investment in IT for your operation. Could you just tell us what you've done and some major, you know, directions that you see in that industry?
Thank you, Rami. As you know, the ecosystem in the health sector is becoming very demanding. The payers, they want cost containment, and at the same time, they want analytical information. The patients, they want engagement, patient engagement. They want to know everything of what's happening to them. And the doctors, they want their money very fast. This cannot happen without the automation. And the problem is with diabetes and obesity in the Arab world it's the highest until now. This is putting a lot of pressure on the ecosystem to automate. At Nat Health, unfortunately, the biggest challenge was in Jordan, in particular, was the adoption of the healthcare to the automation. The penetration level, I think, is something like 10%, which is very low. But we had a very successful story in Palestine. We managed to do a paperless system that starts with the doctor, and it does a delivery system of the exchange of information. So basically, still, I think we're in the infancy stage of the automation in the Arab world. UAE has been very active in that. Saudi Arabia is following them. But as you know, the payers always want to save money, and they want to detect fraud. And this is where automation and big data plays a big role. And I believe we're getting there. But it needs a political decision for the legalization of the infrastructure as a whole.
Oh, okay, fair enough. And this question really goes to you again, and it's pretty much open to anybody and the floor if they would like to volunteer. There's a question I had hoped to put on the automatic answering devices that you have. So the question is, so, you know, if you have to put in order of importance the factors driving basically the transformation of healthcare and IT, would it be technology and innovation, government policy, payers, or patient demands and expectations?
Okay, there is two schools. There is a school that says do not regulate and let the private sector lead. And there is a school that says, no, you need to have a legislation to control, because sometimes some people will abuse the system. I'm a strong believer of, you know, in the Arab world, you have to force it through the government. So I'm a believer that there has to be regulations to control the flow of the information, the security of the information, which is very important, not only in the Arab world, also if we are going to attract people, medical tourism from outside, there is rules and standards that we have to comply with, and without complying with, they're not going to come here. So you have to start with the infrastructure and the legal infrastructure first, and then the technical infrastructure with all the international standards.
Before, I'm going to give you, I see you would like to answer that, and I know your experience has a lot to speak about this point specifically, but since this question was originally intended for the audience, just with a show of hands, just to interrupt siestas if any are having, regulate or leave the private sector to do its work. Who is for the regulate? Can I see just a general perception? That's the regulate. Government should interfere and set the rules. I would never have thought you, of all people, you. So I assume the rest are the private sector. Can we see the hands for the private sector to do its work? Obviously, there's about 45% of the room that doesn't have an opinion on either, but that's...
Jawad, you're being very political.
That's a siesta perspective. Jawad, only one hand, one opinion. There is no in between. So, okay. We're going to go back to you, Feras, for a moment. You've started to roll out the electronic health records in the country. And, I mean, we were colleagues at some point in time, and I think we both pulled our hair as we battled that. So, would you tell us why you think, I assume you're for the regulate by the government side, so would you just share your experience and what you want to say about that?
Well, as of today, we're in, I'm not sure if the audience know, Hakim program, if you heard about it. That's the program that we're rolling across the whole country. It's a national deployment of EHS for the entire public health sector in Jordan. Basically, our experience tells me, when we started the program, it was really a nightmare, because the regulation of even putting the e-signature itself, in place, it took us like 2.5 years. And without getting this in the right order, this means that physicians has to duplicate their work. They have to do paperwork as well as electronically. And that's, again, you will lose the buy-in, you would lose the adoption, etc. So in a nutshell, there is no way that we can move forward. After a while, I figured it out. There is no way without having the government interfere in a way or another in order to push things in the right order. Otherwise, yes, in a naturally speaking, we think, definitely it should be fine if the customers like it, if the providers see it as profitable or as something they will learn from it, they will get their infos out of it. But unfortunately, this is not enough. What matters really to have the government support and the government interference in order to regulate and to make things happen. Again, we're talking about personal health record. Today, there are lots of laws has to come in place. How to regulate these things, to make
like what, for example?
One of the examples, okay, tomorrow citizens put his certain part of his records. The physicians at the public sector needs to come and try to help him or to send them a message backward. This means, again, would the physician be entitled of the money or not? That's a question that's happening right now in the US even, You're taking most of the providers' time to help on the personal level, something that eventually need to think about financially if this needs to be rewarded, and how much effort would it take from him per day to respond to those emails or to those personal records, because supposedly the patient shouldn't put all his data directly to his public or to his what we call it, to the health records. It has to come through one of the provider to be installed or to be entered, and that again would allow more time from his primary or her primary physicians to be part of this cycle in order to fit it in.